Your one-time Medigap Open Enrollment Period is the 6-month window during which you get to enroll in any Medigap plan offered in your zip code without having to worry about health questions. Many people are unaware that this is not an annual window, and then they miss their chance to buy comprehensive Medigap coverage when they can bypass the underwriting process. So let's talk about who qualifies for this open enrollment period and what happens if you miss it. Medigap plans are policies that you can purchase from private insurance companies that pick up where Medicare leaves off. These policies will help to pay for things that Medicare doesn't, like your Part A hospital deductible and copays, and your coinsurance on both Part A and Part B. These comprehensive policies are important because who can afford to pay 20% of the cost of knee replacement surgery or 8 weeks of chemotherapy? Some people may have health conditions by the time that they turn 65, and since this could cause problems trying to get Medigap coverage, Medicare gives everyone a one-time Medigap open enrollment period during which you can apply and absolutely know that your application will be accepted. Your Medigap open enrollment period starts with your Part B effective date and it runs for 6 months. During this window, you can apply for any Medigap plan that you want, including the popular plans like Plan G or Plan N, from any insurance company that you like in your area. You are guaranteed to be issued the coverage without any health questions asked. Once this coverage is in force, no one can take it away from you unless you fail to pay your premiums. These policies are automatically renewed each year, and you can never be dropped for developing a new health condition in the future either. Here's the catch though. Once that 6-month window is gone, if you are 65 or older, you usually won't get a second chance to apply without answering health questions in most states. Where people go wrong is when they misunderstand the annual election periods for Medicare and what they are. For example, Medicare has an annual election period every fall from October 15th to December 7th. This is the window when you can change your Part D drug plan or a Medicare Advantage plan if you have one. It has nothing to do with Medigap plans, and it is not an opportunity to enroll in a Medigap plan and be guaranteed an approval. However, some of Medicare's terminology confuses people and they make assumptions that are just not correct. After all, the term annual election period or open enrollment period sounds like a time when you could sign up for whatever you want. And so this is such a common misconception that if you watch some of our other videos here on YouTube, you will hear me warning people about it quite often. Now, I want to mention a couple of exceptions where someone could get more than one Medigap open enrollment period. The first is for people who have qualified for Medicare under age 65 due to a disability. These people will get an open enrollment period when their Part B first becomes effective, even though they're under 65. And then they're going to get a second open enrollment period later when they turn 65 and transition from disability Medicare benefits over to Medicare age-in benefits. This is important because in some states, people can't get Medigap plans under age 65. So for them, it's crucial to get that chance at a guaranteed issue policy when they turn 65 and now can finally buy a Medigap policy. The second exception is for people over 65 who go back to work and gain health insurance from a large employer. If they cancel Medicare Part B because they now have employer insurance, and then later on they retire, they will rejoin Part B and get a new open enrollment window to enroll in any Medigap plan without underwriting based on their new Part B effective date. It's also important to know that there are a handful of states where the rules are more lenient. For example, if you live in New York or Connecticut, you'll have open enrollment all year round. This makes the plans generally more expensive than in many other states, but at least you'll know that you can get the coverage if and when you need it. In several other states, there are expanded open enrollment rules in certain situations or times of year, such as your birthday month or the anniversary of when you first bought your Medigap policy. To see if your state offers any special open enrollment rules for Medigap, you can look your state up at boomerbenefits.com or continue watching our other videos here on YouTube.